Greetings. My name is Herron Mitchell. I am currently a hospital administrator for Foremost Family Health Centers, which is a federally qualified health system in South Dallas. 5 locations that service the whole community, from fully insured patients to patients that are below the poverty level. I started my career in manufacturing, working for a automobile Fortune 500 company, General Motors, one of the big three. And I spent about 9 years there, moving through various positions, ranging from central office, where I was covering material availability, to actually direct plant manufacturing production. And so that's where I learned Lean and Six Sigma, which was a pathway for me into healthcare, where my first job was at Heartland Health, St. Joseph, Missouri, which is a Baldrige Award-winning hospital. They really embraced Lean and Six Sigma and needed individuals like myself that had that skill set to come in and promote that. I then moved to Dallas, Texas, working for Parkland Health, one of the major anchor hospitals in Dallas County. And now I'm at my current position. It's a non-traditional path, but what I feel is that all of it was transferable, lots of transferable skills from manufacturing into healthcare, things that I bring with me and I use to make our patients' journey through their continuum of care both safe, efficient, effective, and equitable, and also patient-centered. The thing that inspired me, or that is the basis of why I chose this path, and what I've done all my life, is I really like to help human beings, whether that be with their education or their financial position or their health, now with their health. So as the undercurrent of anything that I do, it is trying to help society be better. And really, if I am fortunate enough to retire, to look back on my career and say that I did enough to make my mark on the human community. So specifically, I've worked in underserved areas in different capacities really all my life. And my mother is a retired nurse, and I think that's the first taste I had at volunteerism. I was actually a candy striper at the hospital. They didn't call us candy stripers, but it was the equivalent. They call us porters. And so I would transport patients around, had hundreds of hours at the local hospital where she worked, where I just worked for free, helping patients. And then that has actually transcended throughout my career. Even when I was at General Motors, when I was in Detroit, I used to help inner city children with taking SAT, ACT. I simply cannot stay on the bench. And that in itself drives me personally and professionally to seek out areas that need my type of expertise and where I can make a career out of it. And I've been able to do that for just going on about 20 years now in some type of capacity. So really it's helping people and just solving problems. When you think about success, I think that as you move throughout your career, it changes. When I was younger, it was maybe getting the next position or the next challenge. Now it is really looking at some of the measures and metrics that define the organizations that I'm aligned with, and seeing, are we really making an impact in the community? That is really what drives what I would call success. So it's not so much my success. I think as I've gotten older, it's my team's success, my organization's success, and then how is that impacting the external environment, especially when we're talking about healthcare, when it's a very people-centered, a very patient-centered industry. Are we making people healthier? So personally, success is, what do I come home to? That's kind of linked to what you do at work. Can I look myself in the mirror and say, have I done enough? But then also, can I look at my family and see, are they successful? Am I supporting my wife? Am I supporting my children as they go off and start their lives? And with that being said, I think that I've been extremely successful in terms of personal. Professionally, healthcare is difficult. So as long as you have that drive, I think that if you keep pushing and pushing toward that nirvana, which is really theoretically something you'll never aspire to, you're just getting far enough to hand the baton to the next person. That's success. And as far as my family is concerned personally, as long as they're there to smile and look at me and say they were happy, that's success for me. Some of the misconceptions have changed over time, and a lot of it was fueled by the COVID pandemic. A lot of misconceptions in the community about trust and integrity in the industry, whether or not the industry had your best intentions or your best safety or your best health as part of their key goals. I think there was kind of a gap started, and because before the pandemic, it was trust your physician. During the pandemic, there was a little bit of, and I think the public pulled back a little bit. So it behooves us to try to work to make sure that we regain their trust around vaccinations, around these care plans that we put in place. And I think really, due to the Affordable Care Act and where we're going with value-based care, that is really where we need to go. Prior, it was fee for service, so you come in, it's kind of like being on a hamster wheel. You never were getting healthy. Right now, we're being incentivized for making populations more healthy, and really that in the core is how we're going to get quality medicine out. And I think once people understand that we're looking more holistically at the patient and their total health, then the trust will come back. And we got to have to get the payment structure right. Right now, all the money's kind of going to the healthcare, the hospital systems. Well, really, if we took that same money and invested on preventative medicine, you will probably receive multiples on improvements in healthcare. So those are some of the misconceptions, and we have a long way to go, but we're working on it. We are undergoing some of the most difficult times in healthcare right now, with staffing shortages, funding reductions, like I mentioned before, kind of mistrust from the public. But I will say, within the last 5 years, the most significant challenge I ever had was COVID. And I was placed in charge of standing up 2 sites in Dallas County with the government, working with FEMA, working with local government officials and departments to stand it up. That was the largest operation that I've ever undertaken. And when I say in charge, I mean in charge from at the time, Parkland Health perspective. I was over the operational part. We had many other leaders that helped with this, that were my compadres, from Dallas Fire and Rescue, from the water department, even leadership from Parkland, who basically left their job and came out to the sites to be at ground zero so we could set up testing. That was very difficult. It was a major organization. Everybody had their eyes on it. From the local politicians to government entities like FEMA, like the Department of Health. So all eyes were on me from if you take Tupac phrase. And it was stressful, but because of my background in manufacturing and because I put a great team together, we were able to take the government's concept of operations, improve upon it, and we actually got to where we were seeing 1,000 people a day per site. And we never were off. We're 7 days a week. That was the most grueling schedule I've ever had. And I'm thankful that I went through it, but I don't wish that on anybody. But that was the most challenging thing that I ever did. I would just like to say thanks, Patrick, for having me on. I would tell everyone, don't look badly on your mistakes. And what I mean by that is, the only real mistake that you can make in your life is not trying something. If you fail at something, that's a learning experience. I think Nelson Mandela actually put it masterfully when he said, I never fail, I just learn. So don't be afraid to try new things. Have the courage to stand up for your ethical background and what you believe is right, and push for what your belief system says you can push for. Because really, in the long run, it's about you and how you develop yourself and how you feel when you go home, how you feel when you walk away from those types of situations. Just make sure that you're always finding your ethical base and using that to move forward, because that's how industries get better. We are led by, or we are influenced by and directed by our culture. You cannot process improve yourself or cut yourself or reduce yourself out of a bad culture. You can't make quality gains you have a bad culture. Culture is a group of stories. It's a group collectively how we feel about ourselves and how we react to those principles that have been created by each organization that drive us to do the things that we do. Tell us how we do things, how we interact with patients, how we increase our customer satisfaction. And that starts with you. You are all the change that an organization needs. And sometimes you can vote by getting promoted, or you can go vote with your feet, but always remain true to yourself.